Good afternoon or good morning, depending on where you're joining us from. My name is Jennifer Schleman, and I am the Assistant Vice President of Marketing and Communications for the National Health Council. I'm excited to kick off today's webinar, which is the final in the three-part series we have hosted to provide the healthcare community a practical introduction to health literacy. Next slide, please. Created by and for patient organizations 100 years ago, the National Health Council brings diverse organizations together to forge consensus and drive patient-centered health policy. The NHC's core membership includes the nation's leading patient organizations whose logos are listed on this slide. Next slide, please. For the first hour of this webinar, will be recorded and available on the NHC website afterwards. The second hour is a workshop for NHC members and non-members who have registered for our Science of Patient Engagement Symposium. All attendees are automatically muted and cannot unmute themselves. We ask that if you have any questions during the session, please submit those through the Q&A or chat functions. Also, just wanted to remind folks that our Science of Patient Engagement Symposium is next week, next Wednesday and Thursday. And is part of our Trust in Science initiative that includes the webinars that we've been doing the past few weeks. We hope you can join us for the symposium next week. And you can find more about registration in the chat. And that link actually just went in. Thank you, Silka. Next slide, please. So today for our speakers, we have Chris Casey, who's been with us throughout the program. Chris is the Senior Health Communications Coordinator at HLM. He provides technical and creative expertise and content development in support of HLM's health literacy, health communication, and training programs. Joining Chris today is Diane Webb, who's the Assistant Director of Program Development at HLM. She works with HLM's partners to create customized health literacy programs and products, which includes the group's Clearly Communicating Clinical Trials, or C3T program. That's a mouthful. So I'm happy to present Chris and Diane. Thank you.
Okay, thank you very much. Thanks, Jen. And again, thanks to everyone at NHC for helping us get these webinars together and reaching the community here. So let's just jump right in. So here's our agenda for today. For really the next hour, actually, for just the webinar portion. So we're going to start by framing the relationship between health literacy and science communication. Next, we'll go into some of the practical health literacy strategies that we use to present numbers and risk, because these are sort of elements of science communication that are relevant for health literacy. We'll get into communicating uncertainty next, how to talk about risk and evolving information. And then lastly, we'll show some resources for health literacy and communication best practices, specifically for this science communication piece. And we hope to reserve some time at the end for question and answer. Okay, so there is a big communication gap between those who write science or health materials and the patients and the public who read them. And it's a tangle of factors, including a patient and caregiver are required to navigate many processes to understand and get healthcare. For example, until very recently, most clinical trial materials were developed without input from patients and their preferences. Because of this, many factors work together to form a gap between the important information in a material patients and caregivers. So today, we're focusing on one factor that stands in the way of understanding: health literacy. Health literacy is a set of tools and processes where you use your skills and training to understand the science. Next, we apply health literacy strategies to show the purpose and answer questions that your audience are likely to have about your topic. So next, we test materials with your intended audience to make sure that what you intend to communicate is what people are actually understanding or receiving. And lastly, we learn, adapt, and revise materials and messages that we produce based on audience feedback from audience testing. And as you might guess, this is an iterative process. And the tools of health literacy do not work in opposition to the regulatory requirements and guidelines for health materials, such as informed consent forms and patient inserts for medicines. In fact, many of these same regulations require clear communication with patients. Within the intersection of both sits clear communication that addresses all these requirements. So just to show an example, these are before and after examples from a plain language clinical trial summary that we revised. The examples on the left show how information on adverse events were presented in the original document. On the right is our revision. Some of the changes we made to our revision were to, whoops, forgive me, I clicked it too soon. We're to put the numbers in a table format that clearly shows the two groups within the clinical trial, group A versus group B. We use familiar words for the adverse events, such as using shortness of breath instead of the jargon word dyspnea. I'm not even sure if I'm pronouncing that right, dyspnea. And then lastly, in this example, we use the percentage and the frequency or the actual number of participants who had each adverse event. And something to note on this example, adverse events and serious adverse events are terms that the general public and general audiences may be unfamiliar with. So these terms were clearly defined on another page of this summary. So that's hopefully gives a little bit of background to kind of frame up why health literacy matters for science communication. And so let's move on to the second part of our agenda, which is applying health literacy strategies to present numbers and risk. So these are the 5 main categories of health literacy strategies that we've covered in the first 2 National Health Council webinars. If you've been on any of those, hopefully these are familiar to you by now. These include tailoring your message to your purpose and audience, making your content easy to navigate, using clear and direct language, making your material actionable by telling readers what you want them to do, and using clear design to draw attention and improve comprehension. Today, we're going to focus on the principles that are especially important in science communication for a patient audience. This includes a 6th health literacy strategy to use clear numbers and risk language. Today, we'll talk about how to present numbers and risk and how to visualize data. Before we dive into numbers and risk, let's look at an example for just a quick review that shows the 5 health literacy strategies that we've already covered in the previous 2 webinars. If you missed these trainings, you're in luck because, as Jen said, National Health Council will post the recordings of these trainings on their website. So again, in a quick review of those strategies, here's an example of a consent form we revised for a hospital. It's a consent for pregnant women to have their labor induced, and it's full of jargon, and it doesn't tell women what they need to do with the material. There is no clear call to action, only a blank line at the bottom with patient signature under it. By contrast, here is the health literate version that we revised, which clearly shows the material's purpose and audience in the title. It defines induced labor. It uses reader questions as headings. It gives 2 clear calls to action: talk with your doctor and sign here. And it adds elements such as call-out boxes and even a photo of a pregnant woman's belly. So now I'm going to turn it over to Diane after that quick review, who's going to talk about clear numbers and risk language.
Hey, good morning, everyone. So Chris, hopefully I have control of the screen now. So I'm going to pick it up so we can start to talk about the content that's especially important for this webinar, which is use clear numbers and risk language. Okay, so when we're talking about using clear numbers, this relates to the principle of numeracy. And numeracy is the ability to understand and use numbers in daily life. So this includes things such as understanding blood sugar readings for someone who's diabetic, estimate out-of-pocket health insurance costs, or how much you might pay if you go for a healthcare service, and even use the correct dose of medicine, especially if you think about liquid medicines where you have to fill a syringe. And the reason that we're talking about this is because low numeracy is a big problem. The most current numeracy data that we have comes from the 2013 Program for the International Assessment of Adult Competencies, or PIAC for short. And it found that in the US, 30% of adults are at or below level 1 for numeracy skills, with level 1 being the lowest out of 5 total levels. So what this means is that at or below level 1, a person can do simple processes with whole numbers, such as counting and adding. They can understand simple percentages, such as 50%, and they can use simpler common graphs and visuals to find information. However, what they cannot do is simple math with decimals, percentages, or fractions, estimate an amount, such as how much a bill might be, or interpret simple data and statistics in tables. So we're going to talk about several different strategies for presenting numbers in a clear way. So let's dive right in with the first strategy, which is to use essential numbers only. So use only numbers that are necessary or essential. So what we mean by this are numbers that will help readers make a decision or help them take action. The best practice is to use these essential numbers instead of ignoring them. So consider your purpose and audience to decide which numbers will be helpful to them. So for example, on the slide here, what you see on the left is a technical results summary from a clinical trial. It uses many numbers and statistics that allow others in the research field to interpret the results. So for example, it shows confidence intervals and p-values. It also gives the change from baseline and both the baseline and end of treatment body fat mass. So this looked at the change in total body fat mass using a specific measure called DXA. And then on the right, this is an example of the plain language summary of the same trial that HLM created. This summary, the audience is for patients and caregivers, including participants who took part in the trial itself. So it uses color, bold text, and simple numbers to communicate the results. So you'll notice that since it was for an audience in the US, for the body fat, it changed kilograms to pounds to apply to the audience. And it also gives just the change, the pounds of body fat lost instead of all 3 numbers of the starting and end and the change. So this is one example of, taking what was a lot of different numbers in content that is for the research community and picking out just the most important numbers to include for a general audience. So our next strategy If you participated in the previous webinars, you likely remember our strategy to define or replace jargon. And there is also a lot of jargon when it comes to math. And so that same principle applies here, that when it comes to mathematical jargon, try and replace it, if possible, with a more common word. And then this is because more people struggle with using numbers and quantitative words than just with reading words themselves. It's also important to avoid statistical or mathematical symbols that might be unfamiliar to people. So on the slide here are some examples of math or quantitative terms and symbols, and their more common replacements. So to name just a few examples, instead of using mean, use the more common word, which is average. Avoiding more qualitative terms like increased or decreased, and instead using higher or went up. This, near the bottom of the list here, we see a symbol which means more than, and not everyone might know what these different mathematical symbols mean, so we recommend using the words instead. So our next strategy is to do the math for your readers. And what we mean by this is to calculate or convert numbers. So based on the numeracy skills that we talked about, not many people may be able to do the math for themselves or do the math to get the correct answer. So help readers do the math to make sure that they get those correct calculations. So for example, instead of simply saying lose 5% of your body weight, a better practice would be to do the math for them and actually show them what it means to lose 5% based on their current starting weight. The next strategy is to use consistent denominators and time frames. When communicating fractions or ratios, compare risks out of the same number. And what I mean by that is the same bottom or base number. This makes it much easier for the reader to compare numbers at a glance. So for example, avoid comparing the numbers 2 in 100 to 7 in 1000. And this is because since they have different denominators, people with low numeracy skills may actually think that their chances of having the allergic reaction is higher or more likely with the pill. And that's because the number here, 7, is greater than 2. So instead, use the same denominator or base number and say, for example, 20 in 1000 to compare it to 7 in 1000, so that the denominators or base numbers are the same. This also works with using consistent time frames. So for example, if you're explaining something in terms of the number of weeks, keep explaining it in terms of number of weeks instead of changing from weeks to months and back and forth. And use what's going to be most relevant to the audience when it comes to that. So the next tip, and this is a question that we often get, which is better, the natural frequency or the percentage? What is easier for a lay audience to understand? And the data on this is really mixed. So natural frequencies, such as 1 out of 3, may help because they give context and imagery, whereas percentages are somewhat abstract numbers. However, some research suggests that readers with low numeracy may interpret some numbers as more risky when they see it in frequency form, like 1 out of 3. And this could be because frequencies elicit emotional imagery, whereas percentages are more abstract or perhaps meaningless. So the best practice and the tip with this is to use both. So use both natural frequencies and percentages when presenting the information. So for example, with what's shown on the slide, we would recommend including that 30% of people will have cancer during their lifetime. That means 1 out of 3 people will have cancer in their lifetime. But the real best option is to test it with your intended audience to see if there is a preferred way to present it. Okay, seems like we're flying through these strategies. So please type questions in the Q&A if you have questions that come up, and we will be sure to leave time for that. So the next strategy is to give numbers meaning. So people have trouble extracting meaning from numbers. So the best practice is to always explain what the numbers mean. Interpret the meaning of the numbers for your readers. This can affect health judgments and choices. So what we mean by giving meaning to numbers is to give them a label. So for example, pairing the number with a label such as poor, fair, or low to help explain what it means. Comparing the labels with numbers can result in greater use of the information for judgments and for taking action. So for example, you might say a high risk above 10% means you are more likely than most people to have problems with this drug. Giving numbers meaning also applies to results of different tests. For example, blood pressure readings or A1C test results. There's an example that I like to share, a personal example of giving numbers meaning. So when I was in my very early 20s, I was diagnosed with diabetes. And I was diagnosed because I had gone to a doctor for a different infection, and they had decided to do blood work because something seemed a little off. Well, as a follow-up, they called me, and the nurse called me and said, your test results came back, your A1C is 10.6, you have diabetes. And while they told me that meant that I had diabetes, I did not have any meaning to the number of 10.6. It was just the number on its own. And it wasn't until I spoke with my sister, who was in training to become a pharmacist and doing a diabetes rotation, that she said 10.6 is really high. Normal is about 5%. So you are more than double that. And I really needed that context of high versus low to help understand what my test result meant. In a similar way of giving numbers meaning, another way to help readers understand it is to give numbers context. Because as in my example, a number by itself doesn't really say much. So for example, look over these sentences. The first sentence, that this drug contains 200 milligrams of caffeine. So how much is 200 milligrams? A lot of times when people think of caffeine, they might equate it to a cup of coffee, let's say, something in your everyday life. And so to give this context, you might say that it contains 200 milligrams of caffeine, which is about the same as 1 cup of coffee. The second sentence assumes that people take the time to know and read the milligrams or the strength of the aspirin that they have in their medicine cabinet at home. And so, someone might not know how many milligrams is in it, but they might know that, for example, it's extra strength. And so adding the number of tablets can really help someone not have to do any math in their head. So for example, do not take more than 650 milligrams of aspirin, usually 2 regular strength tablets or 1 extra strength tablet. Okay, and now I'm going to turn it back to Chris to talk about using visuals to support numbers.
Thank you, Diane. I realized I was muted there. Okay, so Diane's been talking about numbers, how to communicate numbers more clearly, giving them context, and so on. Another way to help people understand numbers is to show them numbers. So to use visuals to support communicating numbers and values. So whenever possible, use visuals to support numbers in your materials. So for example, here's some wording from, typical wording from an informed consent document. You could make it clear by putting this text into a bulleted list, which is something we've talked about in the past. So each item could be a bullet to break it out of just sort of text, a paragraph of text like this. But here's a way to make it even clearer, if I can get the slide to go. So here we've produced a simple timeline to help people see the schedule at a glance. This isn't super, it doesn't show the timeline with super precision or anything like that, but it's just in a real visceral way at a glance. It just shows like, here's one thing that happens and this thing happens next and this thing happens last, and you sort of progress between these different steps. In our next section, we'll actually talk about more visual ways to make numbers clear. Okay, so let's talk about using numbers to visuals to support numbers. One choice is to use icon arrays. So icon arrays are good for showing population level data rather than individual level data. So there's good evidence that icon arrays can help some readers understand ratios and large number sets. Icon arrays that show 100 figures with a certain number highlighted to show whatever variable you're interested in is a good way of representing a quantity while reflecting the percentage of the whole. So as Diane was saying earlier, we've got 1 in 8. The cancer example previously was 1 in 3. So in this example, we have one of 8 people in the UK, or 1 of 8 men in the UK will get prostate cancer at one point. So just showing these little icons and having that 1 in 8 highlighted. Another way to show a larger population is to show this array of you can show sets of 100. You can standardize that number. So here's this other example is a larger population, shows a larger population, and there's a little key at the bottom which shows which icons represent what subgroup of this population. And according to the research about these kinds of icon array visuals, icons that represent people like are shown here, or you might see on the door of a bathroom, and instead of just dots or other abstract shapes are actually the most effective for communicating that data. If I could get the slide to advance, there we go. So if you're using charts to show data, a best practice is to just keep them simple. We all have a lot of data visualization tools at our fingertips, and for the right audiences, those can be useful, but for a general audience, you really do want to keep them simple. And then different types of visuals are better for communicating different types of data or different types of concepts. So for example, pie charts are often used to show the magnitude of the differences within parts of a whole, the different parts of a whole. So in this case, the whole represents new HIV infections in a population. It's Hispanics in 2010. And then the parts of the whole are population subgroups. So you can quickly see at a glance that the one proportion or the is much larger compared to the rest. Bar charts, on the other hand, can show the magnitude of differences across different groups. In this case, here's the causes of death from different, or the magnitude of differences between different causes of death over the last 10 years. They can also, bar charts can also show different things such as changes over time, depending on the way you configure the x-axis and what those categories are. So there's pie charts and there's bar graphs. Line graphs are ideal for showing trends over time, changes over time for one or more variables. We've seen a lot of these for COVID lately with the third spike, or whichever we're on the downhill side of right now. Hopefully that continues. And then in another example, timelines are terrific ways to show numbers that are that are essentially, a timeline is essentially numbers. It's a number of days or weeks or months that elapse between different time points. This timeline happens to be a free PowerPoint template, and we just simply plugged in some simple explanations into. Using a simple timeline like this can help people understand the progression of events, or in this case, the order of doctor visits for a clinical trial quickly and at a glance. Okay, so communicating risk. We've been talking about patients with low numeracy skills, and they have more difficulty using numeric information to inform their health choices. So for example, the NIH recommends that women of appropriate ages assess their need for mammography screening with their doctors. Patients in this case have to evaluate the risks and benefits of their options themselves, or else their doctors must substitute their judgments for their patients' preferences. So how do we navigate this? Well, people need to understand numbers and risk to make these kinds of health decisions, such as for preventive behaviors. A question that's relevant for people is, how much can I lower my risk of heart disease if I exercise? For procedures and outcomes, how much longer will I live if I have the surgery? That's a very fundamental question that people need to have the skills to understand or to ask. And understanding probabilities. So my aunt had breast cancer. What is my chance of getting it? How is my chance different from somebody who doesn't have a family history? And then in turn, how does that inform the decision that women are going to make moving forward? So talking about risk, let's unpack this in terms of language. Again, this is the overlap between health literacy and science and risk communication. So look at sort of a typical or usual way to present risk. So the surgery carries a 15% risk of complication. This risk increases to 25% if the patient smokes or is overweight. So looking at this, people are going to have questions. There's a lot that's not, a lot of context that's not given here. People with the low numeracy, but really anybody, they're going to ask questions like, what does percent mean? What does risk mean? And what does that increase in risk mean? What's the right comparison I should be making? And so just thinking about health literacy and the tools that it gives us, from what we've been talking about today and in the previous two webinars, here you can see how this language unpacks what this means to patients. So a health literate translation to this might be something like, to frame it up front, why are we even talking about this risk information? So we do this surgery enough to know how well it turns out for most patients. So this is data that we're confident in, right? Most patients do well and the surgery goes as planned. And nothing happens afterwards that we do not want to happen, such as bleeding or infection. So framing the idea of what complications even are. But some patients do have things happen that are not good, such as bleeding and infection. So at a very high level, setting the stage for what this means. And then getting into the actual numerical risk information. So out of every 100 patients who have the surgery, 15 of them have one of these problems afterwards. And if a patient smokes or is overweight, they're more likely to have bleeding or infection after the surgery compared to a patient who does not smoke or have too much body weight. So, and I like this because it's an example of communicating in plain language. We sometimes call it like kitchen table language, or the sense of, writing or communicating in the way you'd speak, just, not necessarily informally, but casually, language that you'd use around the kitchen table with your family rather than including a whole bunch of jargon. And so now I'm going to turn it back over to Diane.
All right, thanks, Chris. So on this slide, now what you see is that kind of graphic that we started this presentation with, showing all of the factors that can affect understanding and perhaps a gap between the way health materials and science communication is written and patients and the public's ability to understand and use that information. So one tool that you can use to see how well the intended audience can understand your communication is audience testing. As we mentioned, this is kind of a gold standard to see if the audience can understand and act on the information. Because otherwise, there's no real good numerical indicator of whether or not your audience has understood it. So testing, it allows you to assess that gap in understanding to see what you might need to explain a little bit better or in more detail. And it can also help to identify the factors that might contribute to this gap. So which aspects of it is more difficult to understand? Is it the risk and probability information or something else? So just like a clinical trial or science, there are best practices to help ensure your audience testing yields good results, accurate results. So I want to talk a little bit about that. Here we go. About the best practices for audience testing. So there are different ways you can go about audience testing, and the method you use should really be guided by the material or the communication, and also by your resources and timeline. So first we'll talk about focus group testing. So focus group testing works really well to gather impressions, such as how people may feel about a design or a brand message. It also allows you to gather information or data from a larger group with relatively fewer resources because you're talking to a group of people at one time. But the success of a focus group really depends on the moderator or the facilitator's expertise. So a moderator can easily bring bias to a group or an incorrect conclusion, or perhaps not hear from all members who are maybe not as engaged in the discussion. On the other hand, one-on-one interviews are another way to audience test materials. One-on-one testing can give insight into how well a member of your audience understands the content of your material, or even the usability of a resource, such as a website. This is particularly useful for sensitive information or rare conditions, hard to engage populations, or populations that you know have limited literacy who might engage differently with other members in a group, may not be as comfortable speaking up about something if it's in a group setting. The privacy of one-on-one interviews then really allows the participants, to give more open and honest feedback. But when it comes to resources and staff time, of course, one-on-one interviews can be more time intensive to talk to larger numbers of people. And that's true both in recruitment and in conducting the individual interviews. What we've learned here at HLM is that it is possible to conduct both the focus groups and one-on-one interviews remotely through platforms such as Zoom. And this can really help reduce the time needed. So, travel resources, people coming into the office, especially during COVID, it made us have the ability to continue audience testing despite social distancing and safety protocols. It can also really open your recruitment pool so that, for example, you're not limited to the people in your specific geographic area. You can recruit from nationwide. It can also help decrease the time spent recruiting if you're able to use online platforms and resources such as social media. Okay, so now we're going to move on to the third agenda item here, which is communicating uncertainty and how to talk about evolving information. So understanding scientific uncertainty starts with understanding the scientific process. So often in the past, science played out behind closed doors. In fact, a 2019 study found that while most Americans understand basic scientific concepts, many are less knowledgeable about how science really works. I think that the COVID-19 pandemic and all the communication and information really brought that to life. So for example, during the pandemic, misunderstandings and lack of understanding about the scientific process had some people questioning the often changing facts when it came to COVID-19 due to that misunderstanding of the process. And health literate science communication can really help bridge this gap as well. So from a New York Times reporter, here are a few quotes that really reinforce what we just talked about. So most Americans have a decent grasp of basic health concepts. Exercise is good, junk food is bad, but many are never taught how science progresses. So the first step toward educating the public and winning their trust is to make plans and then communicate them honestly, all the flaws, uncertainty, and all. So let's talk about some strategies that you can use to communicate uncertainty. First, try to manage the expectations of your audience. You can do that by being open and honest about what you do and what you do not know. This will also help to establish trust with your audience. So here's an example from the CDC's website about COVID-19 vaccination. So up at the top, it lists what we do know. And then at the bottom, as you see with the red outline, it lists what we're still learning about. So in this case, in particular, how long COVID-19 vaccines can protect people. And so this is one strategy to communicate the facts, but then also to communicate what we don't yet know for certain. Another strategy to communicate uncertainty is to focus on the need to know information to communicate just those key points. And this is especially important when knowledge is emerging and perhaps changing quickly. So look at this social media post from the CDC. Do you think it limits the amount of information to just what is need to know? And of course, we can't see the whole post here because there's the ellipsis and see more. But to answer this rhetorical question, no, it doesn't limit to just the need to know. It uses a lot of numbers, such as 96%, the number of students of 900,000, that aren't really essential to the message, and so it has too much text overall. Of course, when creating social media posts, the best practice is to try and limit the text to avoid having to use that see more function, because many readers won't even bother to click on it. So what do you think about the corresponding visual that accompanies the social copy? Do you think it sticks to the most important messages? So yes, this really answers the reader's question, how can I help protect my child from COVID-19 in school? And gives, the two pretty key action steps here to wear a mask and get the vaccine. Similarly, when communicating uncertainty, focus on the facts, those key facts, what we do know. You can also cite the source of the fact to help raise credibility. By limiting the amount of information, or to help limit the amount of information, you can also give resources where those readers who want more details can learn more. So for example, this social media post from the NHC, it states a well-established fact: COVID vaccines are safe and effective. So this is an example of a post that clearly also states the source of the information. Oops, sorry, I clicked too fast, and offers resources to learn more. So right here, you'll see that we have resources here where people can learn more. So another strategy is to really focus on the patient or the person. And one way to do that is by showing how it really relates to someone's everyday life. So for example, these social media posts here that you see, they give examples of real life things that people can do now that they're fully vaccinated that maybe wouldn't be as safe to do before being vaccinated. So for example, it shows, answers questions about, can you eat at a restaurant? Can you go to a baseball game? So it shows the benefits of getting a vaccine by using really relatable, real life situations. And one of the last strategies we'll talk about when it comes to communicating uncertainty is to engage trusted community leaders to help share the information with your intended audience. So by building relationships with trusted sources in the community, you can help reach that intended audience, but also make sure that you're reaching them through a trusted way. So for example, you can try to engage different community programs that your audience members attend. You can also consider partnering with faith-based leaders and organizations who members of your audience really see as trusted sources of information. And we know that this relationship building can take time, patience, and commitment, but oftentimes it can be the best way to reach people in certain communities. And I'll turn it back to Chris, and we'll close it out by sharing some resources and giving a chance for Q&A.
All right, thanks, Diane. So yeah, it's just as in our excuse me, as in our previous webinars, we've shown some resources. Some of these are the same as we've shown in the past. However, there are a couple that are new that you won't have seen before, that are relevant to this science communication and numeracy information. So the CDC, well, first of all, this Program for Readability and Science in Medicine resource is really valuable. We definitely encourage you to click on that. CDC has a page on understanding health literacy and the overlap with numeracy. And then lastly, there's a site that's called iconarray.com. It's out of the University of Michigan. And they those allow you to actually enter data and produce those icon arrays that we were showing you previously in the webinar. And you can create something very easily that applies the evidence-based best practice for icon arrays right out of the gate. So it's a great resource for you. And I think the rest of these are ones that that bear repeating, that we've seen in the past before. So with that said, that's really the end of our formal presentation, and we'd love to have a discussion or answer any questions. I see there has been a chat all along that I have not been seeing. And then I see there's a Q&A section as well. I'll just...
Yeah. Hi, Chris. There's one question that came in over the chat about the meaning of numbers and the how they may impact persons of color differently. Have you seen that in any of your research? You know, any differences when thinking about audience and numbers?
I haven't seen any. The sort of population level differences that I've seen have more to do with different demographic variables, you know, level of education, you know, job type, you know, those kinds of things. But Diane, have you seen anything that I haven't?
No, I'm not aware of anything that talks about that level of differences when it comes to numeracy.
Okay. And then we do have several questions from the attendees. A lot about icons and you know, the difference in showing the 1 and 3 icon versus a 3 and 1,000 icon. You know, how many is too many when you're talking about icons to show visually, like the difference of the numbers that you're trying to communicate?
Yeah, that's a great question. We're both chomping at the bit. It certainly matters where it goes. You know, if it's in a social media post where you have a little square and each icon is pretty small anyway, 1,000 is probably too many to show. It's, you know, it just as a pragmatic concern, you know, squint at the icon array, and if the differences sort of disappear because they're too little, that's probably a sign that it's too many to show. We actually had this come up with a clinical trial at informed consent that was showing risks of different risks, and it would there were 3 sets of icon arrays right in a row, and they were in such a small place that it really wasn't useful to show 1,000 icons. But Diane, please add if you'd like to.
Yeah, I would agree with Chris that it often depends on where it's going to be placed. So if there's just one icon array and you're showing, out of 1,000 icons, then I think it's fine. It really comes into the situation of if you're trying to compare sets of risks, and then as Chris mentioned, you might have 3 sets of icon arrays with 1,000. That's when it starts to get a little bit overwhelming and hard to see. If you look at kind of some of the resources that we shared, I believe that typically they talk about using icon arrays for up to like 100 or 1,000 in the denominator. But I would say when it gets above 1,000, it's going to be very hard for people to really see it well and see the impact, particularly see the difference between the colors to show who might be at risk and who might not be at risk.
Jen, it looks, there you go.
Another quick question. Are there tools to measure numeracy levels of the content like there are for literacy levels, such as the SMOG readability formula?
That is a great question. I am not aware of any. And so it really comes down to your own almost checklist of the best practices and strategies. And this webinar talked about some of those best practices, but others that come into place, like using whole numbers instead of decimals. And so I'll let Chris chime in also in case he's aware of something, but I'm not aware of any tool similar to what you can run through Microsoft Word with reading level small, like Fleisch-Kincaid, to do that for numeracy, to put a numerical value or assessment when it comes to how easy is numeracy to understand.
Yeah, I really same. I mean, the SMOG or the Fleisch-Kincaid work because they're a formula where it's the number of words in a sentence and the number of syllables in the words, and you do some math or the computer does math for you. And that's a very discrete calculation. I mean, you can objectively count the number of words and count out the number of syllables, and everybody's going to get the exact same answer. If there's something like that with numeracy, it seems like it would be really complicated because there'd be so many different variables in terms of like what's the data, what's the numerator, what's the denominator, who's the audience, and so on. So yeah, I completely agree with Diane. It's just kind of going through these best practices and making sure that you're applying them, and then doing that audience testing. Are people understanding the data that you're trying to put forward?
In the chat, Lourdes mentioned that the CDC has the Clear Communication Index that might be able to help in some of these areas and have other tools. So the CDC is another really good resource on health literacy tools and information. Jody asked, she represents a rare disease that affects 1 in 110, but they want to show that it's the most common birth defect. How would you do that? Would you do that with numbers, or is this a case where it's better to do it with words and then back that up with numbers?
That's a great question. I feel like on the one hand, that the gist of that is, this is the most common birth defect. And if it's one that's not Jody, if you feel that that's not well understood by your audience or by the public, congenital heart disease, maybe it would be valuable to show a ranking of other diseases that or other birth defects that people are likely to have heard of, or, put a list of them. So someone's going to have heard of one of these 5 that we list. I mean, my gut says for a general audience, knowing, just if you're just making the case that this is super common, way more common than you might expect, that making a precise comparison of congenital heart disease versus fill in the blank, whatever it might be, isn't necessarily going to add a ton of value, but there may be a context where that will make sense to do, maybe a more policy driven audience, policy focused audience, sort of a medical focused audience, making a comparison of that incidence could be helpful.
Thank you. Well, it looks like we are out of questions unless anybody has any last minute question to add. All right.
Oh,
then
looks like something just popped in.
Thank you. Oh, I'm sorry.
Sorry, Jen, I started to interrupt. It looks like maybe one more question popped.
Oh, one more question.
Q&A. Do you have suggestions for addressing lay community and cultural health beliefs related to COVID hesitancy? Yeah, that's a big one.
Yeah, what I would, so one of the resources on the slide, the de Beaumont Foundation, it has a poll on the language of vaccine acceptance. It's the last resource shown on the slide right now. And that has some data from research polls. And so that might be able to answer some of your question here. In general, when it comes to kind of mistrust and talking about past medical things that have happened in certain communities, we don't want to necessarily completely avoid it. Typically, the communities are very aware of it. And so not, adding a ton of detail about it, but saying something like, it's normal if, you might have hesitations here, and then skip to the facts. So skip to the facts about, the vaccine has included a representation of a diverse audience in the clinical trials, and talking about those facts. So addressing the concern and then moving to the facts is a good way to address that.
And I would just quickly add that Kaiser Family Foundation, they have a campaign, they're calling it Greater Than COVID. It's a campaign of videos and other communication assets. And they really have some terrific messaging that, kind of, I'll say talks about the elephant in the room, in a way that's really respectful of different audiences and what their concerns might be, and addresses those with sources, community-based sources. So definitely check that out. Oh, yeah, Kaiser Family Foundation, KFF. If you Google Greater Than COVID and Kaiser, that will almost certainly give you the top result.